Good morning, everybody. I'll be presenting a video on the VERTER. It's an innovation that we have made in Aravind Eye Hospital.
Please set the timer also.
Okay.
Okay, I'll be starting my video.
VERTER. Eversion of eyelids has been a skill-based technique performed by ophthalmologists using their hands. Often it has been proven to be a challenge in situations such as patients with no eyelashes or mud roses, those with deep sockets in uncooperative patients, especially children, and in infective conditions with copious amount of discharge. But the risk of spread of infections through contact during COVID-19 pandemic raised this challenge to a higher level. It was time to come up with a better idea to evert the eyelids without touching. Eversion of eyelids using fingers occurs by combination of two forces, a pulling force by fingers on the eyelashes and a pushing force by the fingers on the upper tarsus. So we thought of recreating these forces without using fingers. Many models were tried. Finally, they were narrowed down to a very simple instrument made of only two materials. One, a double-sided tape, and second, an ice cream stick. The ice cream stick was cut at one end to a length of 3.5 cm and a breadth of 6 mm so that it fit just below the upper border of the upper tarsal plate. To the cut end, a double-sided tape of length 3.5 cm and breadth 5 mm were stuck to. The following video demonstrates the use of VERTER. The VERTER can be used in routine OPD examination. It has a universal usage in all patients including adults, older and pediatric age groups. It can be manipulated to see the area of interest. Also, double eversion can be tried using this instrument.
A similar model was created using 3D printer using polylactic acid. The VERTER can be reused by sticking another double tape over it after sterilizing it.
Its uses include to examine the upper tarsal conjunctiva and superior fornix, to remove the foreign body in the upper tarsal conjunctiva, saline wash in chemical injuries, to examine swellings of eyelid like internal hordeolum and chalazion, to examine lid pathologies. Helps avoid transmission of infections between doctors and patients. Easily sterilized, very cost effective and economical.
Thank you, Dr. Megha. You're done.
Thank you, Dr. Megha. That's a very excellent idea, but a very simple idea at that. And how did you think of doing this? Because this is one of the challenge that we all have in all when you're examining the outpatient clinics. But my question is, does the double-sided tape, one sticking to the eyelashes or eyebrows when you do it, and then the patient's having any pain or any of that sort?
Till now, when we have tried with patients, it has not stuck to the eyebrows or the eyelashes. It has an adhesiveness to the skin, but it is not painful though. It is also not sticky to the skin. It just sticks to the ice cream stick.
Eyelashes and eyebrows.
It's not.
No patient has complained till now about
it. Not so far, sir.
What about, you also mentioned that it works even on patients with hordeolum and all that. Won't it be painful for the patient when you stick this and try to evert it?
Yes, sir. So it'll be better for a chalazion rather than on a hordeolum. It'll be more if it's a hordeolum is tender, it's better not to use it.
I think it's an excellent idea, but a very, very simple.
Yes, sir.
Yeah. In older patients with lid laxity, with the skin laxity or with the dermatocalcisis, do you find any difficulty in sticking of the tape because the skin is very lax?
Yes, sir. It is a bit difficult to do it on older patients with skin laxity, especially because the the double-sided tape actually is loosely attached to the skin actually. So first the skin everts and then the lid everts. So it's a bit difficult. We have to work more on it. Yes. So.
Thank you.
Thank you.
Dr. Megha, you can collect your certificate from Dr. Kim.